Hi guys, good evening everyone, friends. I'm back and now I'm going to continue my discussion or storytelling regarding the necrotizing fasciitis journey I had, which debilitated me for almost a month. Actually, more than a month, including the rehabilitation and medication. Actually, I just been free of the disease for 2 weeks. Less than 3 weeks, yes. I cannot walk, I cannot sit, I'm just lying down the whole time. Okay. So the discussion that I'm going to have with you guys is regarding insurance. Just recently, last week, I need to renew my medical insurance with one medical insurance provider, which is toot. I'm not going to tell you the insurance company where I secure my medical insurance, okay? But we have an altercation because of course I have necrotizing fasciitis and I'm still taking drugs, the antibiotic before, right? So the question is necrotizing fasciitis a pre-existing condition which is considered an exclusion in medical insurance? Doctors, mga friends kong doctors there, attorneys, you know I'm not good in this area, so I need your help, no? My surgeon, infectious doctor, reconstructive surgeon told me that considering this disease of mine was caused by bacteria, it cannot be considered it cannot be considered a pre-existing condition. Because pre-existing condition, as they defined, is any medical condition that is not viral or bacterial in nature, no? Which is already present at the time you secured your insurance, no? They are saying that pre-existing condition cannot be viral or bacterial because if the disease is caused by bacteria or virus, it can be cured, no? It can be cured by drugs, no? And once you are cured, you are free of that disease. That's why it cannot be pre-existing condition. Not like diabetes, cardiac diseases, high blood pressure. When you have that, you will have that for life and it is with you forever. And you need to continuously take the drug in order to avoid escalating your condition. Okay? So now I'm telling the insurance provider that my doctors told me that I don't need to declare it. Kaso because I am an honest person, I will not misrepresent. Considering that I had this necrotizing fasciitis, I need to declare it because it's still an illness. The question the medical insurance was, had you been hospitalized or had you get any disease during the last 12 months? I think that was a question. So I answered in the affirmative. No? I said that I had a necrotizing fasciitis. Right? And because of that, the adjuster, no? The medical insurance provider's adjuster, noted that disease as a pre-existing condition. I may understand that they treat it as a pre-existing illness, considering at the time of my renewal, that disease is present in me and I'm continuing to take the drug to get rid of that disease, then they should not cover it. But my issue is, with respect to the next year's renewal, for example, the 2024 to 2025, because considering it is not a pre-existing condition, it should be covered, right? Okay. Because it's bacterial. And my doctor said that anything caused by bacteria, once cured, you're cured. Not like diabetes. If you have diabetes, you will need medication for life. Okay. Actually, my doctors gave an exception regarding the bacterial infection. If you have STDs, any sexually transmitted disease, or the tuberculosis. Because according to them, once you had the tuberculosis, there is a side effect. There will be a fibrosis in your lungs, and that is what make it excluded as a pre-existing condition, because your lungs has what they call the fibrosis. But for necrotizing fasciitis, wherein nabulok ang aking paa because of a bacteria. Actually, there are 2 bacteria who entered my body. Biro mo, considering this is a rare type of infection, considering this this is a rare infection, not everyone gets this. I got it. You see that? Wow. Should I be happy because I'm lucky to get it? Or should I be sad? I am happy. Why? Because I'm alive. That's the most important thing. I'm alive. God gave me another life. And I'm happy. But honestly, during the time I'm in the hospital, I feel very, very sad because I cannot help myself. I need other people's help for me to be able to do the things that I regularly do. I cannot work. I cannot stand. It took me a month to be able to walk again. Biro mo? Because the necrotizing fasciitis ate my thighs, the right thigh. My God. And because I'm lying down for so long, the muscles in my legs weakened to the point that I cannot stand up. Biro mo, I cannot stand up. I need to go rehab. I had rehabilitation doctor, but I strive my best to walk again because that my willpower, because God gave me another life. God gave me this life again. In reality, I think God gave me a mission which I still need to find. Ano kaya yun? But let's go back to the topic. I'm off topic now, right? So the topic is it pre-existing condition or not? Pre-existing illness versus pre-existing condition. So, for me, I think that is a pre-existing illness wherein during the time of renewal up to the next renewal period, I cannot utilize the agreed amount of my medical insurance because at the time of renewal, it's there. I'm having medication, right? But once I'm cured, like now I'm cured, and I will renew again starting 2024, it should not be considered a pre-existing condition. So doctors, lawyers, my friends, help me. Comment below, okay? Comment and tell me whether or not it's a pre-existing condition or not. Necrotizing fasciitis, okay? Guys, good night. Thank you very much for listening. Bye!